Good afternoon, my name is Aura Soto and I am creating this video for Unit 6 case assessment. Today is December the 11th, 2022. My video is going to be on cystoscopy and urethoscopy. This procedure is done. The cystoscopy is done for the purpose of viewing inside the bladder. So there's a small scope that goes inside the bladder for the purpose of viewing, and also it is another way for physicians to make a diagnosis. Okay, sometimes just to go in and to find the source of blood in the urine, urine infections, or sometimes they also do it to open up the urethra inside, to remove any tumors, remove any kidney stones, or to reset the prostate in males. And for the urethra stent insertion, cystoscopy can be also done at the end of another procedure to check for inadvertent damage of the bladder. Okay, the cystoscopy is also known as cystouroscopy. It has several pieces that the scrub person needs to assemble, so it takes for that to be set up between 10 to 15 minutes to be set up. Now the scope is inside the patient for about 5 minutes while they're doing the procedure. So that's inside there for 5 minutes, but that can be like the longest, 5 minutes for a patient. Okay. So, and the scrub person needs to assemble that, and they need to have the sheet. The sheet is the hollow tube that allows for the passage of the instrument during the procedure and allows for the suctions and the irrigation tubes to go in or to be inserted. The main or the larger channel in the center of the sheet is where the telescope is inserted. Okay, and the side channel allows the insertion of the accessory instruments such as the biopsy forceps or graspers, and the orbiturator is a rod with a round blunt tip and that they put in there, and this is normally inserted into the main channel of the sheet and then is used just during the insertion of the scope. Okay. The orbiturator helps protect the urethra tissue from damages. Once the sheet is inserted through the urethra, the orbiturator is removed and the scope is inserted. So similar to all the endoscope, the telescope portion of the cystoscopy needs a light cable hooked up to it. Okay, this light is called a light source. Okay, and it depends on the procedure being performed. A bridge might be needed to attach the scope to allow for the use of other accessory instruments. Okay, I'm gonna show you here. I have a picture here. I have the bridge, I have the sheet, and I also have the telescope. Okay, so usually the bridge goes attached to those. The bridge goes attached to the sheet, and then the scope goes in there on top of this. Okay, and that's a cystoscopy equipment that they use for this procedure. Now, this procedure, when they go in, they also need the surgeon or the provider or the physician, they need to be able to see very well inside the urethra, since it's a very small, tiny space in there. In order for them to do that, they need fluid. Okay, they use fluid. They use normal saline fluid, just like an IV. I call them IV bag. They're super big, big. And so they hang that from like a IV tube, and then they connect it to where am I here? Sorry. They connected it on the sheet. It has a in and out float in here, and so you connect the IV fluid into the in, and then they also have the out, meaning that the liquid that is going inside the patient's body is gonna come out, okay, through another tube. Okay, this is how the saline looks like hanging. Okay, there we go. I know there's like 3 bags in there. Okay, so that's the continued irrigation setup for the cystoscopy. Now for this, the patient is gonna need a table where to put it, and so I have, there's the table, okay, the cystoscopy table, that's what it's called. Okay, and for this procedure, the patient is positioning for, for the ureteroscopy, the patient is placed in a lithomy position on the cystoscopy table, on the picture that I show you. Okay, a ureteroscopy is also done, and it is a very long, thin scope that is inserted into the urethra through the bladder and into the ureter. Most often, this procedure is done for treatment of kidney stone, tissue biopsy, or treatment of the urethra structure. But it can also be done for diagnostics as well. For the treatment of kidney stone, the urologist insert the uroscope up to the urethra until he or she finds the stone. Depending on the size of the stone and the location of the stone, the urologist might use a stone retrieval basket, okay, to snare each stone and remove it that it might or might not insert the laser fiber. And the shutter, he or she shatters each stone using a laser energy ureteroscope. Okay, this is the laser. A laser fiber. Okay, and then below, this is what they use for the stone retrieval. Okay. The patient is placed on a lithomy position on the table with the legs up in the stirrup. Okay, this procedure takes about 5 minutes. The doctor will use a speculum, some gel, first to insert when he inserts the speculum, he will use some gel, because that's an area that might be a little dry, so that helps being more comfortable for the patient too. Okay, there is a the instruments. Most of the instruments that they use for these procedures are sterile. All of them are sterile, but some of these instruments, the surgical tech or the central services department needs to make sure to follow the instructions of the instrument in order for them to either, for the cleaning purpose, because some of the attachment can be autoclave or steam sterilized, and some of them cannot be cleaned. So, you need to make sure that the scope, the camera, the cord, and so on, they can be autoclaved prior to the sterilization process. If not, it has to be manual cleaning too. It is important to keep up all the flexible or rigid instruments on top of all the heavy stuff, because you don't want to bend it or break it or anything like that. So I got my information for this video out of the Learning Connection in Relays. All my information is from there, and I was very interested to grab this video or to do this video on this topic, because next week on Tuesday I'm gonna be having this exam, so it's kind of nice to kind of get to know what kind of procedure I'm getting done, and how to prepare, what kind of instrument they're gonna be using. So it is good and good learning experience for me. Thank you.